on Daytime Buffalo, we're talking health equity in the 716 with the healthcare experts at Univera. And 716 author and artist Gerald Goodwin talks about his graphic novels. It's all coming up right here on Daytime Buffalo. Afternoon, hello, and welcome to Daytime Buffalo. I'm your host, Chelsea Lavelle. Joining me now in the Daytime Buffalo studio is Christy Simoncelli of Univera Healthcare, here today to talk about health equity. Hi, Christy. Thanks for joining me.
Hi, Chelsea. Thanks for having me.
Why don't you start off by talking about and defining health equity and what it means?
Yeah, so health equity, I feel like, is one of those topics that people kind of think they know, but then if you really are pressed to put words to it, it's sort of hard to describe. But the way we look at things at Univera is really considering that everyone has the right to achieve their best, most optimal health care. And we know that our system is really built on unequal foundations. And so what does that look like, and how does that show up on the day-to-day for people who are trying to achieve healthcare, right? And what goes into that? So we know that the healthcare experience is so complex. It's more than just what happens between an individual and their provider in that one interaction. You know, if we look at how that might show up for someone, so suppose you don't speak the same language as your provider, like that's a huge barrier, right? So these are considerations that we would have with things like that. Accessing care. You know, where people live, do I have transportation? Do I have, you know, the means to get to the doctor I need to get to? We work in a lot of rural areas as well where they don't have specialists. You know, there's very limited access. Sometimes there's not enough dentists. We've even got a few counties that we've identified where there's just complete lack of resources for some of our specialty care items. And so we're looking at the whole person. We want to understand, you know, who people are, how they live, what their life looks like, and offer tailored solutions to them. So those are some of the ways that we see this showing up, because we really want everyone to be able to achieve their full potential for health.
Well, you just gave us some great examples of what this looks like in real life, but can you explain more or expand on who this looks like, who is kind of experiencing these health equities?
Yeah, and in fairness, this could happen really in any population. Very often, it occurs more often in our marginalized populations, people who don't speak English as a first language, people who come from different communities where access has been historically an issue. Things like race, sexual identity, these sorts of things come up and they're challenging. But how does that look like on the day-to-day? You know, if your employer doesn't cover your time off to get a screening for an appointment, or, you know, you're not gonna go. You know, if I have to take a day to prepare for something and then go for it, I'm gonna miss pay the whole time. I'm worried about my job. I'm gonna go ahead and not take care of that health item, right? If I have had negative experiences with healthcare in the past, it's gonna make it a little more challenging for me to go ahead and be proactive for myself, seeking the care that I need. If I, you know, I'm afraid that my health information might be used against me in some information. If I share my sexual identity, you know, will this become a problem for my employer, or how is this? There's just lack of trust in a broad sense. And again, we talked about language issues, but also, what are my housing conditions like? Is it safe for me to get to where I need to get to? And those are some considerations. You know, it's easy for a doctor to tell us to go get our steps in and eat 5 fruits and vegetables a day, but if we don't have access to, you know, safe places to walk or to be active or to even get fresh fruits and vegetables, those are just things that are lost in the system, right? So communication, all these things are really pretty critical as we look forward to who might be involved here. So we want to really offer tailored care for everybody.
Yes, well, now you can tell us what Univera is doing to address these health inequities.
Yeah, so again, this is no small task.
Yeah, that's a big one.
So we're looking at this as a multi-year project, something that we're really digging our feet in and making sure that we're doing the best we can. We're working to ask better questions of our members. We want to know more about the people that we're serving, you know, in all the ways, you know, again, all the things we talked about, race, ethnicity, sexual orientation, you know, your social determinants of health, which is just a fancy way of kind of like what sort of things are affecting you in your day-to-day life. So we are asking those questions, and we're doing it in ways, hopefully, that will be seen as trustworthy. We're going to keep that data safe. We're not going to share it with anybody. We're not going to hold anybody accountable for any of their answers. We're really coming at it in a way to understand how to serve people better. If we can understand a little bit more about someone, we understand their risk status, we understand, where the gaps might be more profound or bigger, and actually reaching people in ways that make sense. Different cultures, different communities are going to respond differently to different kinds of campaigns and ideas. And so those are some of the things that we're weaving in. We're working strategically with our communications folks to put together proper language. We're making sure that things are done at a good reading level, that things go out in ways that are meaningful to people, that they can understand where we're coming from, and they will trust the process that we're trying to put together. So those are some of the things.
Can you tell us about some of the resources that people have to get on board with this campaign?
Yeah, for sure. If any Univera member can always call us, the number's on your card. We're also making referrals to 211 in Western New York, so people, if they have social needs issues that can be solved, hopefully by 211, that those would be a place that would be safe to contact.
Nice. And do you want to explain what 211 is really quickly?
Yeah, 211 is wonderful all over New York State, and I'm sure all over the country actually, but we have 211 Western New York here locally. People can log on to their website or they can call, and they provide resources for pretty much anything you can think of, whether it's I need help with transportation, I need help finding a doctor, I need help finding food or care for my children. They have resources. They're connected into our community-based organizations across the region, and they can make those referrals.
Christy, thank you so much for coming in and explaining this amazing campaign for Univera, and really building that trustworthiness. Like you said, this is a big task.
Yes.
Taking part of the health inequity that's happened, and it's been long instated.
Absolutely.
So it's going to take time to re-break it, but you guys are taking the steps to make sure that you're building that trust and doing something positive for our community.
Absolutely.
So
That's
thank
our
you
goal.
so much for coming in. And
Thank
viewers,
you.
for members of Univera Healthcare, you can call one of their care managers if you feel like you're experiencing any of these barriers for the healthcare that you need. You can call 1-877-222-1240 Monday through Friday from 8 a.m. to 5 p.m. For those experiencing these health barriers, or if you know someone in another community resource is calling, you can do by calling 211 or visiting westernnewyork211.org for free confidential support available 24/7. Thank you again for coming in,
Yes,
Christy.
thank you for having us.